Hello and welcome back to the Healthy Lifestyle Series. I'm Dr. Cheff, and what I want to emphasize today is I want to review the pelvic tilt. I discovered a new way of checking ourselves to make sure that we're doing it correctly. I know some people have a little difficulty with it and maybe frustrate themselves and don't keep up as much as they should. So I have here with me a model of the spine. Shows the 24 movable bones in the spine, and here's the pelvis. This would be a back view of the pelvis in here. If you notice at the bottom, there's two bones. We call these the sit bones because that's where you're going to put your weight when you sit down. And those two places should be touching when you're in a sitting position. We can use those to our advantage when we do the pelvic tilt. That if we were to put two fingers on the seat of our chair and apply our sit bones right on top of those. And then as we pelvic tilt forward, we'll feel the bottom of the pelvis slide against those fingers. And then when you come back, they'll slide back. So you can do a pelvic tilt forward and release it back. And you'll get the sense of how that moves back and forth. And remember, as you're doing the pelvic tilts, you're exercising the discs, getting circulation and pulling out the waste products, stretching ligaments, keeping this vitalized and healthy as far as the joints in the lower back, which contributes to your spinal cord and your nervous system. So this is your foundation from a sitting position. And if I'm in a standing position and I'm going to do a pelvic tilt, if I put a little bend in my knees, I can hinge off of my hips and I pull up and squeeze under my buttocks there. And that flattens the back there. So if we're standing in line at the grocery store, we're waiting, we can just subtly pull that in and flatten the back and relax. Every time you contract or relax, you're vitalizing those joints and keeping them from fatiguing and becoming sore. So practice your pelvic tilts. You can sit on your hands, rock forward, rock back, rock forward, rock back. I'm Dr. Cheff, and to your good health.